is Alexandria, and I'm the Associate Director of Operations for the Center for Global Women's Health Technology at Duke University. And today I am joined with one of our current students, Margaret. Margaret, thanks so much for joining us today. Just to get us started, could you tell everyone a little bit about yourself, what you study at Duke, what year you're at, and just kind of what you're passionate about outside of school?
Of course. Thank you for having me. My name is Margaret. I'm a rising senior at Duke. I am an English major, chemistry minor, and I'm very passionate about many things within women's healthcare. The English major is really a way to understand people in their full environments, cultural, social, and personal. And I really am passionate about maternal and reproductive health. And so that's what sent me to the center. And I was originally involved, I was involved initially through the Basque Connections Women Inspired Strategies for Health. And what I loved about the Basque Connections project was how it brought many of my interests together: innovation, technology, as well as the storytelling component was one team, and I was on the costing team. So really being able to address the issue of cervical cancer and move towards cervical cancer elimination through costing. I then got involved in the Wish Fellows program, and so I really love this opportunity as a way to lead my own research in maternal and reproductive health. And what I'm really excited about is kind of bringing my interests together and looking specifically at access to maternal and reproductive health during COVID-19.
That's great. Thanks so much for sharing, Margaret. So you mentioned kind of some of the projects that you're interested in and ones that you're working on. Is there anything specific that you're working on this summer?
Yes, so I am doing initial sort of literature review and looking at how COVID has impacted access to maternal and reproductive health care. This is sort of encompassing many different topics, whether it's screening, because a lot has been sort of shown about how COVID has led to people not wanting to go for basic medical screenings, and what does that have implications for related to cervical cancer prevention, to access to family planning, to menstrual equity, and access to menstrual products, to access to prenatal healthcare. So there are so many different topics in this field affected, and so right now it's really getting an idea of what data is out there that I can use in order to really narrow in on one specific topic in the field, and then do my own project interviewing stakeholders, providers, patients in this area, as well as looking at more qualitative and quantitative data that already exists related to a specific focus area.
That's really interesting. So kind of at the end of this summer, do you have a goal for what you'll want to be focusing on for your senior year at Duke?
For sure, yeah. So my goal is to find that focus area, and so then senior year I can hit the ground running and create this project, and hopefully my goal is that it will lead to like tangible impact in North Carolina, whether that is recommendations based on the research for better policies within healthcare, whether that's highlighting unique technologies that will better equip patients to live with health and well-being, or whether that's just adding to the wealth of knowledge out there about maternal and reproductive health in order to try to improve and address some of the gaps that currently exist in access.
That's really great. I hope that goes well and you can pinpoint that focus area soon before the fall gets started. So during your time being involved in the center, both through the Basque Connections course and as a Wish Fellow, is there anything that you would say is like the most valuable lesson that you've gained?
That's a great question. And I think being involved in the center has really just reinforced and helped me develop my core values and more motivations in my life. Values of justice, community, women's empowerment, purpose, all of these things I see so clearly in the work of the center and being involved in the Basque Connections, for example. We, especially this past year during COVID-19, during Black Lives Matter, racial reckoning, we really dove into what are the systems at play, and what else is affecting an individual's access to healthcare. So looking at empowerment in a comprehensive way has really informed how I sort of work in this space. And then it's also, as someone who does want to go to medical school and take that route, specifically, I'm really, really interested in becoming an OBGYN, being able to have this perspective and hopefully be able to be a clinician who also is involved in research and advocacy and policy is a goal. And it's something that this WISH Fellows program has specifically really taught me a lot about. Just doing this research has shown how clinicians can be better informed and better involved in the field of obstetrics and gynecology, for example, to make positive change. So yeah, as someone who really is passionate about going into women's healthcare and empowering underserved populations and really working to end inequities in the field, being involved in the center has been a great way to learn and grow as an individual.
That's really great to hear. Thanks so much for sharing that. So Margaret, my last question for you today, do you have any words of encouragement or challenges, inspiration that you would want to give to some of your fellow current students?
That's a good question. I would say, from my experience really seeking to be interdisciplinary in my course of study at Duke, I think just seeking out opportunities, even if it doesn't align with a certain narrative, or if it seems like something different than what you've done before. I was able to find a space that brought together different topics that I thought were disparate and seemingly incompatible with each other, but Duke is an amazing place to find opportunities like working in Basque Connections, or in this research fellowship where I can really bring together my love of women's empowerment, social determinants of health, literature, like all of these things, and find a way to bring passions together. So I just encourage people to be open and look for those opportunities.
Thanks so much, Margaret. This is really encouraging just to hear more about your story and where you have been and where you are hopefully headed in the next couple of years. And thanks for sharing all of this with us. And I'm sure we'll be on the lookout for whatever your research pans out to be in this next year.
Thank you so much. It was great to be here.